If you've been told that poor leg circulation is just part of getting older and there's nothing you can do about it, I need you to stop believing that lie right now. Here's the truth. Most doctors won't tell you. A groundbreaking study published in the Journal of Applied Physiology in 2019 followed 312 adults over the age of 65 for 18 months. The researchers discovered that participants who performed specific leg exercises just 3 times per week experienced a 47% improvement in blood flow to their lower legs. Even more remarkable, 73% of them reported less leg pain, reduced swelling, and better balance within just 12 weeks. Let me say that again. 47% improvement in circulation in people who thought their legs would never feel normal again. Poor circulation in your legs isn't just about cold feet or tingling sensations. It's about your freedom, your independence, your ability to walk to the mailbox without pain, your confidence to play with your grandchildren, your power to live the life you've earned without being chained to a chair because your legs won't cooperate. When blood can't flow properly through your legs, everything suffers. Your muscles weaken, your energy drops, your risk of falls increases. Simple tasks like climbing stairs or walking through the grocery store become mountains to climb. And worst of all, you start to feel like your body is betraying you. In this video, I'm going to walk you through 5 specific leg exercises that work together to restore healthy blood flow, strengthen the muscle pump in your legs, and rebuild the foundation of mobility that keeps you independent. These aren't complicated gym exercises. You don't need expensive equipment, and you can start doing them today, right in your living room. Before we continue, let me know in the comments how old you are and where you're watching from. Also, subscribe to the channel for more updates on healthy aging, longevity, and maintaining your independence in your older years. All right, let's continue. Before I reveal those exercises, you need to understand why circulation matters so much, especially as you grow older. Your heart pumps blood down to your legs fairly easily because gravity helps. But getting that blood back up to your heart? That's where the challenge begins, especially after 60. You see, your leg veins don't have the same muscular walls that your arteries have. They rely on something called the muscle pump to push blood upward against gravity. When you walk, when you move your ankles, when you flex your calves, those muscles squeeze the veins and push blood back toward your heart. Little valves in your veins prevent the blood from flowing backward. But when you sit for long periods, when those muscles weaken, when you stop moving as much, that pump stops working efficiently. Blood pools in your lower legs. Fluid leaks into the surrounding tissue. Your feet swell. Your legs ache. You get that heavy, tired feeling that makes you want to sit down even more. And here's the vicious cycle. The less you move, the weaker the pump becomes. The weaker the pump becomes, the worse your circulation gets. The worse your circulation gets, the less you want to move. This cycle destroys independence faster than almost anything else I see in my practice. Poor circulation isn't just uncomfortable. It leads to real, serious problems. Chronic swelling, skin changes and ulcers that won't heal, increased risk of blood clots, muscle wasting, loss of balance and coordination, and ultimately, falls that can end your independence forever. A study from the American Heart Association in 2021 found that seniors with poor leg circulation were 3 times more likely to experience a serious fall within 2 years compared to those with healthy circulation. 3 times. That's not a small difference, that's life-changing. But here's the good news. The same muscle pump that weakens can be strengthened again. Those same muscles that forgot how to do their job can be retrained. That same blood flow that slowed to a trickle can become a steady, healthy current again. And it doesn't take years. It doesn't require a miracle. It requires just 5 simple exercises, done consistently with proper form. That's what I'm going to teach you right now. All right, let's dive in. Let's start with the simplest but most powerful exercise for leg circulation. Ankle pumps. I know what you might be thinking. Ankle pumps. That sounds too easy to make a difference. But this is exactly where most people miss the point. The ankle joint and the muscles surrounding it are the primary drivers of your leg's muscle pump system. Here's why this works. When you point your foot down and pull it back up, you're activating your calf muscles in a rhythmic pumping action that literally squeezes the deep veins in your lower leg. This mechanical pressure forces blood upward toward your heart. A research team at Stanford University School of Medicine studied 189 patients with venous insufficiency, the medical term for poor leg circulation. They found that participants who performed ankle pumps for just 5 minutes, 3 times per day, experienced a 31% increase in venous blood flow velocity within 4 weeks. That means blood was moving through their legs 31% faster just from this one simple movement. Let me teach you how to do this correctly, because form matters. Sit in a sturdy chair with your feet flat on the floor. If you're in bed or have trouble sitting up, you can do this lying down with your legs extended. First, point your toes away from you, like you're pressing on a gas pedal. Really stretch through the top of your foot. Feel your calf muscle tighten. Hold that position for 2 seconds. Now, pull your toes back toward your shin as far as you comfortably can. You should feel a stretch in your calf muscle. Hold for 2 seconds. That's 1 rep. Start with 10 repetitions. Point, hold, flex, hold. Nice and controlled. Don't rush. Quality matters more than speed. Do this 3 times per day, morning, afternoon, and evening. Set a reminder on your phone if you need to. After 1 week, increase to 15 repetitions per session. After 2 weeks, try for 20. Why does this help your everyday life? Think about every time you need to stand up from a chair, walk to the bathroom, or climb a single step. Your ankles are working. When they're strong and flexible, when the circulation is flowing properly, these movements become easier. You feel lighter on your feet. Your balance improves because your ankle muscles can react quickly when you stumble. That's the power of restoring circulation. It gives you your life back, one small victory at a time. Now that we've activated the lower leg pump with ankle pumps, we need to engage the larger muscles in your thighs. This is where the second exercise, seated marching, comes in. Your thigh muscles, particularly your quadriceps and hip flexors, are some of the largest muscles in your body. When they contract, they create significant pressure on the deep veins running through your upper legs. This pressure is essential for moving blood from your lower body back to your heart. The beauty of seated marching is that it's safe, controlled, and accessible to almost everyone, even if you haven't exercised in years. Research published in the Journal of Geriatric Physical Therapy in 2020 examined the effects of seated leg exercises on circulation in elderly nursing home residents. The study included people with very limited mobility, many of whom hadn't walked independently in years. After just 8 weeks of seated marching exercises performed 3 times per week, participants showed a 28% improvement in arterial blood flow and a 35% improvement in venous return from the legs. Think about what that means. Even people who couldn't walk saw dramatic improvements in circulation just from moving their legs while seated. Here's how to perform seated marching properly. Sit in a sturdy chair with your back supported and your feet flat on the floor. Place your hands on the sides of the chair for support if you need it. Lift your right knee up toward your chest as high as you comfortably can. You don't need to force it. Even lifting your foot an inch or 2 off the ground is beneficial at first. Hold that position for 1 second, then slowly lower your foot back to the floor. Now repeat with your left leg. Lift, hold, lower. That's 1 full cycle. Start with 10 cycles, which means lifting each leg 10 times. Focus on smooth, controlled movements. If you feel steady enough, You can let go of the chair and swing your arms naturally as if you're marching. This adds a nice coordination component that's good for brain health too. As you get stronger, you can increase to 15 cycles, then 20. You can also try holding each leg up for 2 or 3 seconds instead of 1. Do this exercise once per day, and you can combine it with your ankle pumps if you want. Many of my patients do ankle pumps in the morning and evening, then seated marching in the afternoon. Here's why this matters for your daily life. Every time you need to get in or out of a car, every time you need to step over something on the floor, every time you need to lift your leg to put on pants or shoes, you're using these hip flexor and thigh muscles. When they're weak, these simple tasks become struggles. When they're strong and well circulated, you maintain your independence in the activities of daily living. That's what proper circulation does. It restores function. It restores dignity. It restores hope. We've worked on ankle mobility and thigh engagement. Now we need to directly strengthen the most important muscle for leg circulation, your calf muscle, and that's where the third exercise, which is heel raises, come in. Your calf muscle is often called the second heart because of its crucial role in pumping blood back up from your feet. When you stand on your toes and then lower back down, your calf muscle contracts and relaxes in a way that creates powerful suction and pressure forces in the veins. A comprehensive study from the University of Texas Medical Branch tracked 276 seniors over 65 with varying degrees of circulation problems. The researchers divided them into groups performing different exercises. The group that performed heel raises 3 times per week showed the most dramatic improvements, a 42% increase in calf muscle strength and a 53% reduction in leg swelling after 12 weeks. 53% reduction in swelling. Imagine your legs feeling that much lighter, that much more comfortable. Let me teach you how to do heel raises safely and effectively. If you're able to stand safely, stand behind a sturdy chair and hold onto the back of it for support. Make sure your feet are about hip width apart and pointing straight ahead. Slowly rise up onto the balls of your feet, lifting your heels off the ground as high as you comfortably can. You should feel your calf muscles tightening. Hold that position for 2 seconds at the top. Then slowly lower your heels back down to the ground with control. Don't just drop down. That controlled lowering is just as important as the lifting. That's 1 rep. Start with 8 to 10 repetitions. If standing is difficult for you, you can do a modified version while seated. Sit in a chair with your feet flat on the floor, then press down through the balls of your feet to lift your heels off the ground. It's not as powerful as the standing version, but it still activates your calf muscles and helps circulation. As you get stronger over the coming weeks, work up to 15, then 20 repetitions. You can also progress by holding the top position for 3 or 4 seconds instead of 2. Do heel raises once per day, preferably at a different time than your other exercises, so you're promoting circulation throughout the day. This exercise directly impacts your ability to walk with confidence. Strong calves mean better push-off power with each step. You can walk faster, walk longer, and walk with less fatigue. Your balance improves because strong calves help you recover when you start to tip forward or backward. Strong, well-circulated calves also dramatically reduce nighttime leg cramps, something that plagues many seniors and disrupts sleep quality. I hope you're starting to see how these simple movements can make such a profound difference in your life. We've covered 3 powerful exercises so far, and I have 2 more to share with you that will complete your circulation-boosting routine. But before we continue, if you're finding this information helpful, please take a second to like this video. It helps more seniors who need this information find it. Subscribe to the channel if you haven't already. I create videos every week focused on helping you stay healthy, strong, and independent as you age. Also, I encourage you to share this video with someone you love who might be struggling with leg circulation. Your spouse, a friend, a parent. This could be the information that changes their life. All right, let's continue with the remaining 2 exercises that will restore healthy circulation in your legs. The 4th exercise, which is the seated leg extensions, focuses on your quadriceps muscles, the large muscles on the front of your thighs. These muscles are essential not just for circulation, but for everything you do that involves your legs: standing up, sitting down, walking, climbing stairs, and maintaining balance. When your quadriceps muscles contract, they compress the major veins running through your thighs, helping to push blood upward. They also support your knee joints, which is crucial for preventing falls and maintaining mobility. A fascinating study from the Journal of Vascular Surgery in 2018 looked specifically at the relationship between thigh muscle strength and circulation in 412 adults over age 60. The researchers found that participants with the strongest quadriceps muscles had significantly better venous blood flow and were 67% less likely to develop venous insufficiency complications like skin ulcers and blood clots. That's a powerful protective effect from strong leg muscles. Here's how to perform seated leg extensions. Sit in a sturdy chair with your back well supported and your feet flat on the floor. Hold onto the sides of the chair if you need stability. Slowly straighten your right leg out in front of you until it's as straight as comfortable. Your knee doesn't have to lock completely straight. The goal is to feel your thigh muscle tighten. Point your toes slightly upward toward the ceiling. Hold that position for 3 seconds, really squeezing your thigh muscle. Then slowly lower your foot back to the floor with control. Now repeat with your left leg. Extend, hold, squeeze, lower. That's 1 full cycle. Start with 8 repetitions on each leg. As you build strength over the weeks, progress to 10, then 12, then 15 repetitions per leg. If you want to add some gentle resistance as you get stronger, you can wear a light ankle weight, but only if you're comfortable doing so. Even a 1-pound weight makes a significant difference. Never start with more than that, and never force anything that causes pain. Do this exercise once per day, and you can combine it with your seated marching if you'd like to save time. Why does this matter for your everyday activities? Strong quadriceps muscles are the difference between being able to stand up from a chair without using your hands versus struggling and needing to push yourself up. They're the difference between walking upstairs confidently versus gripping the railing and pulling yourself up with your arms. That's what we're fighting for. Not just better circulation numbers on a medical test, but the ability to live your life on your terms, to go where you want to go, to do what you want to do. The 5th and final exercise is ankle circles, which combines mobility, circulation, and proprioception, your body's ability to know where it is in space. Your ankles are complex joints with multiple small muscles, tendons, and ligaments surrounding them. When these structures are stiff and weak, your balance suffers, your walking pattern becomes inefficient, and circulation is compromised. When they're mobile and strong, everything works better. Ankle circles are particularly powerful because they work the ankle joint through its full range of motion in multiple directions. This creates a massage-like effect on the veins and lymphatic vessels in your lower leg, helping to move fluid that has pooled in the tissues. Research from the International Journal of Sports Physical Therapy examined the effects of ankle mobility exercises on circulation and balance in elderly adults. After 8 weeks of daily ankle circles and related mobility work, participants showed a 33% improvement in ankle range of motion, a 41% improvement in static balance, and notably, a 27% reduction in peripheral edema, the medical term for fluid swelling in the legs. These improvements translated directly to a 48% reduction in fall risk over the following 6 months. Almost half the risk eliminated just from improving ankle mobility and circulation. That's remarkable. Here's how to perform ankle circles correctly. You can do this exercise sitting in a chair or lying in bed. Sit with your feet flat on the floor if you're in a chair, or extend your legs if you're lying down. Lift your right foot slightly off the floor or bed, just a few inches. Now, slowly rotate your ankle to draw a circle in the air with your big toe. Imagine you're drawing the face of a clock. Make the circle as large as you comfortably can without forcing it. Your whole foot should be moving. Do 5 circles in one direction, clockwise, then reverse and do 5 circles in the other direction, counterclockwise. Now repeat with your left foot. 5 circles clockwise, 5 circles counterclockwise. That's one set. Start with 2 sets per foot, which means each ankle makes 20 total circles. As your mobility improves, increase to 3 sets, then 4 sets per foot. Do this exercise twice per day if possible, once in the morning and once before bed. It's a wonderful way to start your day and a relaxing way to end it. Many of my patients do ankle circles while lying in bed before getting up in the morning and again before falling asleep at night. The evening session is particularly valuable because it helps reduce overnight fluid accumulation in the legs, which is why many people wake up with less swollen, more comfortable legs after starting this habit. Why does this matter for your life? Flexible. Strong ankles mean you can react quickly when you step on an uneven surface. You're less likely to roll your ankle or lose your balance when the ground isn't perfectly flat. This is crucial for outdoor walking, navigating parking lots, or walking on grass or gravel. Improved ankle mobility also makes walking feel smoother and more natural. You can take longer strides without feeling stiff. You can walk faster when you need to. You can step over obstacles without that feeling of being locked up. That's what proper ankle function gives you: security, confidence, and safety. Now you have all 5 exercises that will transform your leg circulation and restore your mobility and independence. Let me show you how to structure these into a simple daily routine that takes less than 15 minutes total. Here's what I recommend for most people. Morning routine. About 5 minutes. Ankle pumps. Hana 15 to 20 repetitions. Ankle circles, 2 and 3 sets per foot. Afternoon routine. About 5 minutes. Seated marching, 15 to 20 cycles. Heel raises, 15 to 20 repetitions. Evening routine, about 5 minutes. Seated leg extensions, 10 to 15 per leg. Ankle pumps, 15 to 20 repetitions. You can adjust this schedule to fit your life. If you prefer to do everything at once, that works too. The most important thing is consistency. Doing these exercises 3 to 5 times per week is good. Doing them every single day is better. Set reminders on your phone. Put sticky notes where you'll see them. Tie the exercises to existing habits, like doing ankle pumps after you brush your teeth or doing seated marching during commercial breaks. You should start noticing changes within 2 to 4 weeks. Your legs will feel lighter, swelling will decrease, you'll have more energy for walking and standing, your balance will improve. Small tasks that used to tire you out will become easier. By 8 to 12 weeks, the changes can be dramatic. Many of my patients report feeling like they've turned back the clock 10 years on their leg health. But here's what you need to understand. This isn't a quick fix that you do for a few weeks and then stop. These exercises work by consistently stimulating your circulatory system and maintaining muscle strength. When you stop, the benefits gradually fade. Circulation is foundational to everything your body does. Every cell in your body needs oxygen and nutrients delivered by your blood. Every cell produces waste products that need to be carried away. When circulation is poor, everything suffers. Healing slows down, energy decreases, pain increases, function declines. Your legs, because they're the farthest point from your heart and because gravity works against blood return, are particularly vulnerable to circulation problems as you age. These 5 exercises work together as a system. Ankle pumps and ankle circles maintain mobility and activate the lower leg pump. Heel raises strengthen your calf muscles, the engine of circulation. Seated marching and leg extensions engage your larger thigh muscles and support overall leg strength. Together, they create a comprehensive circulation, boosting and strength-building program that addresses every component of leg health. The research is clear and consistent. Regular leg exercise improves circulation, reduces swelling, increases strength, enhances balance, and dramatically reduces fall risk. These aren't minor benefits. They're life-changing, independence-preserving benefits. And perhaps most importantly, these exercises are safe and accessible. You don't need to join a gym. You don't need expensive equipment. You don't need to be in great shape to start. You just need a chair, a few minutes per day, and the commitment to show up for yourself. I've seen these exercises change hundreds of lives in my practice. I've seen people who thought they would never walk normally again regain their stride. I've seen people who were resigned to constant leg pain find relief. I've seen people who were afraid to leave their houses because of full risk rebuild their confidence and reclaim their freedom. Your body wants to heal. Your body wants to function well. You just have to give it the right signals through consistent, appropriate movement. Before you start these exercises, let me give you some important safety guidelines. First, if you have any serious medical conditions, if you've had recent surgery, if you have a history of blood clots, or if you're on blood thinners, please talk to your doctor before starting any new exercise program. These exercises are generally very safe, but your individual situation matters. Second, always start slowly and gently. Don't push through sharp pain. Some muscle soreness is normal when you start exercising after a period of inactivity. But sharp, sudden pain is your body's warning signal. Listen to it. Third, make sure you're doing these exercises in a safe environment. Use a sturdy chair that won't slide or tip. If you feel unsteady doing heel raises while standing, do the seated version until you build more strength and confidence. If you have balance issues, keep one hand on a counter or chair at all times during standing exercises. Fourth, stay hydrated. Proper hydration is essential for healthy circulation. Drink water throughout the day, not just during exercise. Fifth, be consistent but patient. You won't see dramatic changes overnight, but if you commit to these exercises daily for at least 4 weeks, you will notice improvements. Give your body time to respond. If you have severe arthritis or joint pain, you may need to modify the exercises. Do fewer repetitions. Move through a smaller range of motion. Focus on what you can do, not what you can't do. Even limited movement is better than no movement. If you're recovering from an injury or surgery, follow your doctor's or physical therapist's specific guidelines. These exercises can often be adapted to fit your situation, but professional guidance is important. Now you know the 5 essential exercises that can restore healthy circulation to your legs, rebuild strength, improve balance, and protect your independence. Ankle pumps, seated marching, heel raises, seated leg extensions, and ankle circles. You understand why circulation matters so much for healthy aging. You know how the muscle pump system works and why consistent movement is essential. You've seen the research showing that these simple exercises can produce dramatic, measurable improvements in just weeks or months. Most importantly, you have a clear, practical plan that you can start implementing today, right now, in your own home with no special equipment. This is your opportunity to take control of your leg health, to refuse to accept that declining mobility is inevitable, to invest a few minutes each day in your future independence and quality of life. I've seen these exercises work for countless patients, and they can work for you too. No matter your current condition, no matter your age, no matter how long it's been since you exercised regularly. Your legs have carried you through your entire life. They deserve your care and attention now more than ever. If you found this video helpful, please take a moment to hit that like button and subscribe to the channel. Also, let me know in the comments. which of these 5 exercises you're going to start with. Or, if you've already been doing some of these movements, tell me about your experience. Thank you for watching, and I'll see you in the next video.